Some diseases disappeared because medicine defeated them. Others disappeared because sanitation improved, food became safer, or vaccines broke the chain of transmission. But a few diseases never truly surrendered. We can name them. We can see them under microscopes. We can map their genes and explain exactly how they damage the human body. And sometimes, that still is not enough. These are 10 ancient diseases and disorders that modern medicine still struggles to defeat. Number 10. Rabies. It can begin with something almost meaningless. A dog bites a child, or perhaps it only licks a hand with a tiny scratch. The wound heals, the animal disappears. For days or even weeks, nothing happens. That silence is what makes rabies so terrifying. The virus enters peripheral nerves and slowly travels toward the brain. During that journey, the victim may feel completely normal. And this is the strange dividing line that defines rabies. Before symptoms appear, modern medicine is extraordinarily powerful. Post-exposure vaccination can prevent the disease when given in time. After symptoms appear, the situation changes almost completely. The patient develops anxiety, confusion, agitation, painful spasms, difficulty swallowing, and the famous fear of water known as hydrophobia. Saliva increases. The nervous system begins to fail. At that point, survival is extraordinarily rare. Human beings have feared rabies for thousands of years. Ancient civilizations already understood that something terrible could follow the bite of a sick animal. Today, we understand the virus in extraordinary detail, yet once it has reached the brain and neurological symptoms have begun, medicine has almost no reliable way to reverse the process. The difference between life and death can still be one simple question: did treatment arrive before the symptoms did? Number 9. Ergotism. Imagine a medieval family sitting down to eat bread. Nothing smells unusual. Nothing looks poisoned. Yet inside that loaf may be enough toxin to destroy hands, feet, and minds. Ergotism was caused by a fungus that infected rye, one of the most important grains for poor communities in medieval Europe. The contaminated grain could be harvested, milled, baked, and eaten without anyone understanding what had happened. The toxins produced two horrifying forms of illness. In one, blood vessels tightened so severely that circulation to the fingers and toes collapsed. The tissue became numb, then dark, then dead. In severe cases, parts of the limbs could be lost. The other form attacked the nervous system. Victims convulsed. They experienced terrifying hallucinations. Some believed they were seeing demons, angels, flames, or supernatural creatures. Medieval people called the disease St. Anthony's fire. And strangely, some monasteries became known for healing it. The explanation was probably not supernatural. Patients entering those hospitals often stopped eating contaminated rye and received different food. Without realizing it, the monks were removing the poison. Today we know the fungus. We know its chemicals. We understand what those chemicals do to blood vessels and nerves. But understanding the cause does not mean reversing the damage. Once tissue has died from loss of circulation, no modern drug can simply bring it back. Number 8. Porphyria. For centuries, European villages told stories about people who avoided sunlight, behaved strangely, and looked somehow unnatural. Later generations called them vampires. Medicine offers a more complicated possibility. Porphyria is not one disease but a family of disorders involving the body's production of heme, an essential component of blood. Different forms produce different symptoms. Some cause extreme sensitivity to sunlight. Others can cause abdominal pain, neurological problems, confusion, anxiety, hallucinations, or violent agitation. Certain severe forms can also change the appearance of the skin and gums. To someone living hundreds of years ago, the pattern could have seemed supernatural. A person stays indoors during daylight. Their appearance changes. Their behavior becomes unpredictable. Their urine may become unusually dark or reddish. Without genetics, laboratory testing, or modern biochemistry, there was no framework for understanding what was happening. Porphyria is not proven to be the single origin of vampire folklore. Rabies, nutritional disorders, burial customs, and other conditions have also been suggested. But the important point is simpler. Real medical symptoms were once interpreted through supernatural explanations because no better explanation existed. Today, doctors can measure porphyrins, identify specific enzyme problems, and sometimes identify the exact genetic mutation. But many hereditary forms are still managed rather than eliminated. The monster has disappeared from the diagnosis. The underlying defect has not. Number 7. Leprosy. In medieval Europe, receiving a diagnosis of leprosy could destroy far more than your health. It could destroy your legal identity. People diagnosed with the disease were sometimes separated from their families, removed from normal economic life, and forced into isolated communities. In some places, the separation was so extreme that rituals resembling funerals were performed while the patient was still alive. The message was clear. You still breathed, but socially, you were already dead. The tragedy is that leprosy, also called Hansen's disease, is not easily transmitted through casual contact, and today it can be cured with multi-drug therapy. But the social disease has proved harder to eliminate than the bacterial one. In communities where fear remains strong, a diagnosis can still lead to rejection, unemployment, broken marriages, or isolation. That makes leprosy unusual on this list. Modern medicine possesses an effective treatment. The biological enemy can be defeated, yet the medieval fear surrounding the disease can survive after the bacteria are gone. A person may finish treatment and no longer represent an infectious threat, but neighbors may still avoid them, employers may still reject them, families may still carry shame. Medicine found a cure for leprosy. It never developed a pill for stigma. Number 6. Noma. Noma can begin with something as small as an ulcer inside the mouth. Then, in the most vulnerable children, the destruction can accelerate with frightening speed. The infection spreads through soft tissue. The cheek begins die, the lips may be damaged. The jaw may become exposed. Within days, a minor-looking oral lesion can become a devastating wound through the face. The disease overwhelmingly affects severely malnourished children living in extreme poverty, especially where sanitation and access to medical care are limited. And this is what makes Noma different from many other terrifying diseases. It is not unstoppable because scientists do not understand it. Early antibiotics, wound care, improved nutrition, and basic medical support can dramatically change the outcome. The problem is reaching the child in time. Noma once appeared in Europe as well. As nutrition, sanitation, and access to healthcare improved, it largely disappeared from wealthy countries. It survived where the conditions that allow it to flourish survived. That makes Noma less a mystery of biology than a mirror of inequality. Modern medicine has tools that can stop the disease. But a treatment that exists in a hospital hundreds of kilometers away might as well not exist at all. Some diseases survive because science has not found the answer. Noma survives because the answer does not always reach the patient. Number 5. Tuberculosis. In 1882, Robert Koch identified the bacterium responsible for tuberculosis. It was one of the great turning points in medical history. At last, humanity could see the enemy. More than a century later, tuberculosis is still here. It spreads through the air. It thrives where people live or work in crowded, poorly ventilated conditions. Malnutrition and weakened immunity make it more dangerous. And treatment presents another problem. Tuberculosis usually requires multiple drugs taken consistently for months. If treatment is interrupted or incomplete, resistant bacteria can survive. That creates strains that are much harder to kill. Drug-resistant tuberculosis turned one of medicine's greatest victories into an evolutionary arms race. New medicines attack the bacterium. The bacterium changes. Another combination is developed. Resistance appears again. The disease also exposes a global inequality. For someone with reliable healthcare, transportation, medication, and time away from work, months of treatment may be difficult but possible. For someone who must choose between attending a clinic and earning enough money to eat, the same treatment becomes much harder to complete. Tuberculosis has been studied for generations. Its biology is known in remarkable detail, but knowledge alone has not been enough. Humanity discovered the enemy long ago. We are still fighting the war. Number 4. Lupus. Most diseases on this list involve something attacking the body. Lupus is different. The attacker is the body itself. Systemic lupus erythematosus is an autoimmune disease in which the immune system loses the ability to reliably distinguish friend from enemy. It attacks healthy tissue. The joints can become painful and swollen. The kidneys can be damaged. The heart and lungs can become inflamed. The nervous system can also be affected. One of its most recognizable signs is a butterfly-shaped rash across the cheeks and bridge of the nose. But lupus is notoriously difficult to recognize because patients do not all experience the same pattern. Symptoms can appear, disappear, and return. One person may begin with fatigue and joint pain, another with kidney problems, another with skin symptoms. Modern medicine has become much better at controlling lupus. Doctors use medications that suppress or regulate immune activity. These treatments can reduce flares and protect organs. But suppression is not the same as a cure. The deeper problem remains. The immune system has mistaken parts of its own body for a threat, died the immune system completely, and the patient cannot survive infections. Leave it uncontrolled, and it may damage the patient's organs. Every treatment, therefore, becomes a balancing act. The enemy is not inside the body. The enemy is the body's own defense system following the wrong orders. Number 3. Guinea worm disease. This disease produced one of the strangest treatments in medical history. A worm emerges from the skin. You wrap it around a stick, then you pull very slowly. Guinea worm infection begins when a person drinks contaminated water containing tiny organisms carrying the parasite's larvae. Inside the human body, the larvae develop. The female worm can eventually grow to an extraordinary length. Months later, it migrates toward the skin, usually around the lower leg or foot. A painful blister forms. When the affected person places the limb in water, the worm releases larvae and continues the cycle. There is no dramatic surgical extraction. Peel too hard and the worm can break. That can trigger severe inflammation and secondary infection. So the traditional method is patience. Wind a small section around a stick, wait, then repeat. Humanity has used versions of this method for centuries, and despite everything modern pharmacology has produced, manual extraction remains important once the worm is emerging. The extraordinary victory against guinea worm came from preventing infection instead. Fluoridating drinking water, educating communities, stopping infected people from contaminating water sources. The disease has been pushed close to eradication. Not because medicine invented a brilliant new way to remove the worm, because public health made the ancient stick increasingly unnecessary. Number 2. Fibrodysplasia ossificans progressiva. There are people whose bodies slowly build a second skeleton. The condition is called FAP. Soft tissues such as muscles, tendons, and ligaments gradually turn into bone, not metaphorically. Actual bone, a shoulder can become locked, a hip can freeze, the jaw may lose movement. Sheets and bridges of new bone can connect parts of the skeleton that were never meant to be joined, and then comes the cruelest part. Injury can trigger more bone formation. A fall can make the condition worse. An injection can become dangerous. A biopsy can cause damage. Surgery to remove unwanted bone may provoke the body to build even more. That creates one of medicine's worst paradoxes. Trying to help can accelerate the disease. Researchers identified a key genetic mutation associated with classic FAP. The problem lies in a signaling pathway involved in bone formation. The body receives the wrong message. Inflammation and injury can be interpreted as instructions to create bone where bone should never exist. We can describe the molecular error. We can identify the mutation. But safely correcting that biological signal is enormously difficult because the pathway is also involved in normal development and tissue function. This is the nightmare of modern genetics. Sometimes we can identify exactly what is broken. Knowing the broken part does not automatically give us a safe way to repair it. Number 1. Fatal familial insomnia and prion diseases. The final disease is frightening because the enemy is not a bacterium, not a virus, not a parasite. It is not even alive. A prion is a misfolded protein. Proteins normally fold into specific shapes that allow them to perform their functions. But a prion has taken the wrong shape. When it encounters normal versions of the same protein, it can cause them to misfold as well. One wrong shape creates another, then another. The abnormal proteins accumulate. Brain tissue begins to deteriorate. Familial insomnia is one of the rare inherited prion diseases. Its most famous feature sounds almost impossible. The patient progressively loses the ability to sleep. Not ordinary insomnia, not a bad night. The neurological machinery that regulates normal sleep begins to collapse. As the disease advances, sleep becomes increasingly impossible. Confusion follows. Hallucinations can appear. The nervous system deteriorates. Eventually, the disease is fatal. And prions violate many assumptions medicine traditionally makes about infection. They contain no DNA, no RNA, they have no metabolism, they cannot be killed in the ordinary sense because they were never alive. Modern science can describe their structure. It can study the genetic mutations associated with inherited prion diseases. It can watch the process unfold inside the brain. And yet there is still no established cure capable of stopping the fatal cascade once it begins. That may be the most unsettling lesson of all. For centuries, medicine advanced by learning more. See the pathogen, identify the gene, understand the mechanism, design the treatment. But nature does not promise that understanding will always produce control. Sometimes we know exactly what is happening. We know where it happens. We know why it happens. And still, the disease continues. That is the uncomfortable boundary of modern medicine, not ignorance, knowledge without an answer. And somewhere beyond that boundary are diseases we have already named, already mapped, and still have not learned how to defeat.